Hi everyone, I'm Emma Howitt and I'm the Chief Executive Officer at Middlesbrough and Stockton Mind. I don't want to assume that everyone's heard of Mind, so just to let you know that Middlesbrough and Stockton Mind's a local mental health charity that's part of a national network of 120 independent local minds across England and Wales. It's great for me and my organisation to have this opportunity to participate in an event that's not solely health focused, so thank you very much. The three things I'm going to cover in my 10-minute slot are Middlesbrough and Stockton Mind's experience of nature-based activity and ecotherapy, what social prescribing is, both now and our ambitions for it for the future, and why we're developing a green social prescribing project with our partners. So, our experience. One of the things my organisation does really well is occupy both the space of health and clinical provision, often funded by the NHS, and the space of the voluntary sector, delivering asset-based community projects in partnership with local people based on their skills and interests. This can be a tricky space with a mixture of challenges around funding and clinical requirements that have to be managed, but the approach has allowed us to grow and diversify as a charity to support more people in our community, now over 10,000 people each year, working with people on their mental health and wellbeing in broad and varied ways. Middlesbrough and Stockton Mind started delivering our first ecotherapy project as part of a National Mind programme in 2009. The programme was called Eco Minds. Mind commissioned an independent evaluation from the University of Essex, which was published in 2014, which evidenced improvements in mental wellbeing, self-esteem, and improved mood, which added to a growing evidence base around this work. The evidence is there that nature supports mental health in many and varied ways, including positive effects on specific mental health problems like anxiety and depression, and maintaining good mental health through improving sleep, giving positive experiences, and providing social connections. Although our first Eco Minds programme ended, we've continued to work with local partners to make sure that people that we're working with know about the opportunities that are open to them, and to deliver our own nature-based projects where we can. So what's social prescribing? If you haven't heard of social prescribing yet, you probably have heard of other similar concepts like exercise on prescription. Social prescribing is a way of connecting people with health conditions, usually those people presenting at GP practices, to wider services and projects in the community which will improve their quality of life, enable them to live healthier lives, and manage health conditions more effectively. The process is usually supported by a worker, and ours are called link workers. For GPs, it's a way of supporting patients who are presenting in primary care but for whom medical interventions either aren't appropriate or not the full picture of the help that those patients need. For GPs, it's having people in their care team who understand and can tap into mainstream and community services for their people and patients, including, we hope, those nature-based activities. So social prescribing has developed in different ways in different areas, but hasn't been an approach that's been embedded in primary care in Teesside until last year, when NHS England began resourcing it through their contracts with GPs. Over the last 18 months, Middlesbrough and Stockton Mind has taken up this opportunity to work alongside GPs and others in primary care to develop a model that's relevant here on Teesside. Formally starting in April this year, so right at the first lockdown, which was pretty challenging, our link workers contacted over 2,000 vulnerable people initially on behalf of GPs to make sure that their immediate needs were being met at that time. Since then, we've provided one-to-one support for more than 1,400 people, the vast majority of whom wouldn't have received community-based support otherwise, and the vast majority of whom had a mixture of mental health difficulties and other complex issues in their lives. We're strong advocates of social prescribing, as you can imagine, but it's not a panacea. When we started, we were concerned that the approach was at risk of being oversimplified and thought to be all-encompassing, and therefore wouldn't help those who needed it the most in our communities, those most vulnerable people that Shada has already described in her presentation. So social prescribing helps connect people to each other, to opportunities, to support that they need in their lives, but it takes a lot of work. There are barriers that people face that are beyond our control and beyond the individual's control, like transport provision, like poverty and caring responsibilities. And community connections aren't that end goal for everyone, given the health challenges experienced by many people in our local population. I'm sure you can appreciate that the caseloads of our workers filled up really quickly. And although many people achieved their goals and moved on, waiting lists still need to be managed and probably always will. NHS guidance on social prescribing expects link workers to have the capacity to undertake community capacity building to support small voluntary organisations and community groups to be accessible and sustainable and help people to start new ones. My view is that that's unrealistic. It's a different area of skills and knowledge that not everyone in our social prescribing team has, and they often just don't have the capacity to do it. But the opportunity is there for us to work collaboratively with our social prescribing team and with the people that they're supporting, with other mainstream services and the voluntary sector, to understand more the barriers experienced by people who are presenting at GP practices, who are not taking up those community opportunities that are available to them, including nature-based activities. If we don't work collectively, on the other hand, the community opportunities won't be there, and the benefits of our social prescribing work will be significantly reduced. And we've already seen how much people have been affected by losing their community resources during lockdown. Social prescribing can be a catalyst that brings people together and draws in the resources to work together to make this happen. And that's what we're hoping to demonstrate through our Green Social Prescribing project. So on to green social prescribing. I'm just checking my time. We know that green social prescribing works because we know that nature works for people, and we know that social prescribing works. So we want to see if by working together, we can create some sustainable collaborations between health, and particularly GP-based healthcare, and nature-based organisations and projects. Now, we have growing buy-in from GPs around that holistic model of care and some momentum behind our work. The Green Social Prescribing model has been developed collaboratively with 5 local partners who are already offering nature-based opportunities in Middlesbrough and Eston. So Barefoot Kitchen, Middlesbrough Environment City, Investing in People and Culture, Tees Valley Wildlife Trust, and Youth Focus Northeast. And I'm sure other partners will come on board as the programme develops. Project resources will be used to support individuals to access these projects, but really importantly, resources will also go to those partner organisations to deliver their nature-based projects in ways that are accessible to people with complex life experiences, those people that we're coming across in our social prescribing programme. The project will be open to anyone, but will be specifically targeting young people aged 13 to 25 who we know have been disproportionately affected by COVID, as Shada just described as well. We also know there's a crisis in mental health care for young people, and clinical services are nowhere near meeting need and demand. Our partners already do great work with this age group, and we want to demonstrate again that we can improve mental health and wellbeing for young people who are currently presenting at their GPs by connecting them with participatory nature-based projects. Alongside our social prescribing project, we're also working with GPs to look at how we can develop social prescribing for young people in collaboration with the voluntary sector, youth sector, to get even more young people involved there too. So I start to get really excited about how we can finally create pathways for people of all ages through super complex health systems to what could be real long-term well-being. Thank you.